So public health is mental health, and mental health is public health. Here's what we know about health is it is not just the absence of infirmities. It is a state of complete physical, mental, emotional well-being. So to be healthy, all of those things that impact your physical health are important. The things that impact your mental, emotional, behavioral health are very, very important. That's why we always say that trying to separate this is really impossible. They are intertwined, they are interconnected, and they're together. If I am not feeling well, if I live in an environment, if I live in a home that is not conducive to my emotional, mental health, there are ways that I respond. I would not take care of myself. I would not eat properly. I would not want to interact with people. All of those will end up impacting your ability to attain the optimal health possible for you. So pretty happy that this has been emphasized during the National Public Health Week, and we've worked with the team throughout throughout this past year. And I think some of these are really exemplified by some of the happenings for the past 1 year, the pandemic, some of the social unrest. All of those things impact people's emotional health, and by virtue of that impacts their physical health and their overall health.
I think we know that the pandemic has certainly impacted us individually, all of us. It's impacted our communities, but we've not only been forced to work and battle the coronavirus, we've also had to fight the virus of hate. And so when you look at the pandemic, that has just been one factor over this last year. We have a whole host of other things, the social unrest that we've experienced, the racism that our communities experience, the polarization and all of the things that kind of separate one another from each other. That's exactly what we don't need to be doing. We need to be coming together. We need to be looking to support one another. And so while we look at all of these things that have impacted our physical health, they have absolutely impacted our mental health as well. So it's not surprising that we see people with increased anxiety, increased depression. And it's also not surprising that we see individuals that have serious mental illnesses having more difficult times adjusting. Because some of the things that may have worked in the past aren't working for them or not available to them today.
Some of the work that Teams Group has done in the past few years is part of why the impact of this pandemic has not been felt the way it could have been, because people now know where the resources are. People are comfortable seeking those resources. And my thing that I tell people, okay, is it's okay to not be okay. But it's more important. It's okay to be kind. It's okay to be nice. Tim talked about some of this social unrest and not being nice to other people. It's almost like being nice is out of fashion. So we've got to get to a point where we are letting our people understand. So no prejudice is good for health. Racism is not good for health. That's why you are seeing places that are coming out and telling you that racism is being declared as a public health problem. And so any form of prejudice or oppression right now in the news, you are seeing some of our Asian colleagues that are being targeted. Those things are not good for public health. They're not good for emotional health. They're not good for mental health. I know when I read about those things, they affect me in some way. So we have to get to a point where we continue to educate our residents. And that's part of building the resilience that we need to do to get to build, to take the next step as a community.
Engaging our community, educating our community about public health, about mental health is important. And I think the number one thing is being able to have access to healthcare, access to mental health care. And so when we talk about state or federal legislation, we really need to be focusing on helping people be able to access health care so that they can have that state of well-being.